So I started my research at UNC Chapel Hill during my PhD. I worked a lot on understanding the impact of a specific type of shoe design on muscle activation and forces in the anterior part of the leg. We had seen a bunch of patients coming in with complaints of anterior shin pain, and we're concerned that the design of the shoe was in fact what was causing that problem. You know, the next goal in some of that work is to understand shoe design more for gender-specific footwear. Right now, most of the shoes that are made are a men's shoe that's just shrunk down in size for a woman. And so a lot of what I hope to continue working on is understanding the differences in the design of shoes that are specific to women, and then also eventually to kids, to help with sort of the development of good foot mechanics from a young age. And so when I moved over to Duke to run the Mike Krzyzewski lab, I kept that same set of interests in injury prevention, worked mostly in shoe design with cleats and fifth metatarsal stress fractures, and then eventually moved over into the work that I was doing towards the end, which was looking at post-operative follow-up in patients who had joint replacements, so total hips, total knees, total ankles, to really understand whether some of the movement difficulties that we were seeing in younger patients were in fact also there in the older adults after they'd had surgery. So my vision for the Granata lab going forward is to really continue the work that I was doing at Duke in terms of injury prevention, to expand that out and really work with a variety of people, from the mechanical engineers to the guys in the athletics department and the people over at VCOM, to really start to understand ways that we can begin to intervene, whether that is through exoskeleton work with the mechanical engineers or through therapeutic design with both VCOM and the athletics department, but really take a more whole body look at how we treat injury and how we prevent injury, as opposed to focusing on a single joint and a single injury. More of a holistic look at, how is a person moving and whether that changes with time, whether injury impacts that and how it impacts that, and then how we can recover following that to prevent an injury going forward.